Good afternoon, everyone, and welcome to the August 20th, 2025 Bridging the Gap Subcommittee meeting, which is a committee of the opioid settlement group. So we want to welcome everyone. We're going to move it right along because we're on a strict schedule today. Each presenter will have 20 minutes, and we're going to cut you off at 20 minutes if you're not done, and then 10-minute answering period. So be cognizant of your time as we move along. So first of all, I would ask for approval of the minutes of August 18th, 2025.
So moved.
Support. I have a motion by Commissioner Collins, supported by Sheriff Bevere. Is there any additions or corrections? Are there any additions or corrections? I guess I should say. Hearing none, all those in favor signify by saying yes.
Yes.
No. Motion carried. I'm not sure if Judge Morgan will be here or not. Okay, he's excused for training. And of course, you know, Chairman Martis is overseas. So old business. Any old business? Hearing none, moving right along to new business. Our first presenter is prevention media campaign by Lenawee Broadcasting of Southeast Michigan. Ms. Julie Kane. Welcome, Julie.
Thank you so much. My name's Julie Kane. I'm the president and general manager of Lenawee Broadcasting Company in Southeast Michigan Media. And today we are presenting you with a campaign that has a goal to build community awareness and also support all of the other agencies and programs that are going to be that will have services related to this opioid project. So it's all encompassing. So the goal is that the agencies will be able to feed us information to populate the things that we're doing. Can you move the slide?
Next slide.
Okay. That's all right.
We won't take this away from your time.
It's okay. I timed my presentation to 15 minutes, just in case I got off on a tangent. Which we in broadcasting sometimes do. Okay, so the first goal is going to build community awareness through a website that we will build out that's called stoptheaddiction.org. And if you can click that, Jen, and we can go to, so this is a prototype of a website that we'll be building. And if you can look up on the top, some of the bars across the top, it will tell you about, it will tell you causes, it will tell you events, it will tell you news. So all of those things we will use and we will populate with things that are happening in and around Lenawee County with the other agencies that are going to be part of this grant. So it's meant to be a community hub for all of that information. And this message will be embedded through a whole campaign, not just the website. The campaign will also focus the radio, it will focus social media, it will focus online. And we do have an audio file of a commercial that we probably would like to start with because the goal is going to be to drive people to this website to find out about the community resources in Lenawee County.
That's why there's a stoptheaddiction.org. Not a hotline, not lecture, a simple app right here in Lenawee County. The putting places with real people who can help the end of criminal abuse. When you hit bottom, you don't have time to search. You need the door, and you need it open. Stoptheaddiction.org, because tonight could be the night. stoptheaddiction.org. Help here now.
So that would just be one of the campaigns that we would use to drive people to the website. We would also be using some of the radio commercials to support other agency programs. It would be a multimedia campaign that would be 5 spots a day on 3 of the radio stations, building brand awareness for the websites and also programs that are going to be funded by the grant. It'll include participation in all regular season high school and college sporting events, which we think is really, really important to reach both students and student parents. And those, of course, are broadcast on WLEN 965 The Cave, and we also do those in video on Lenawee TV. So we think that's really important as a place to reach the demographic that we're looking for. This is also going to include live broadcasts for the drug take back days that we've done before in the past. We have participated in drug take back with live broadcasts. The other part of the multimedia campaign will be digital display ads on WLEN.com, and we'll be targeting and engaging people with news and information. So as you can see, the radio stations individually reach between 14 and 16,000 listeners every quarter hour. So that is the demographic of each station. And of course, all the stations have a different demographic. And I've included some information in the packet I left you. Towards the end of the packet, there's a page that's called By the Numbers, and it gives demographics of each radio station. So WLEN's listeners are different than the country station listeners, who are different than the sports station listeners. The sports station tends to skew more male. I don't know if that's true, but supposedly Nielsen tells us that that's true. The surveys tell us that's true. I'm a big sports fan, so I listen to that station, but so we're going to be reaching a whole different demographic on all 3 radio stations. So the radio we're really using to drive people to the website and to other programs. So if you look at an average of 15,000 listeners per quarter hour, based on the commercial cost, it's less than 1 cent per impression. So a good value for your dollar. We do like to drive all of our digital campaigns include radio because we know radio drives digital. And I'll give you an example from the health department. Last year, the health department had a display ad on WLEN.com, and it averaged 5 to 7 clicks a day. So there was a county program that was behind this ad, and we broadcast 2 announcements on a Saturday morning directing people to that ad on our website. And the clicks went from 5 to 7 on average. That day, there were 174 clicks on that ad. And I believe it was an obesity study on Lenawee County. And people obviously found that of interest. And then the next day, the results showed 17 click-throughs. So we know how powerful radio is in driving traffic to online resources. So we always want to include radio in the mix. So we're also going to include 24 community video podcasts. And those podcasts we will create with other people doing the program. It will be created with the Sheriff's Department. We will create them with Lenawee Community Mental Health. And those are going to be featured in audio on the radio. They will be living online at WLEN.com. They will be on Lenawee TV, and they will also be on our YouTube pages for the radio stations, which get a lot of activity. So on WLEN.com, we have 577,000. We had 577,000 unique users last year. So obviously, if there's 100,000 people in the county, we have more than countywide coverage. That was unique people that came to WLEN.com over the course of a year. We had 41,000 unique monthly users. And we had 6,000 unique users that were coming on a weekly basis for news. And they were specifically coming for news and not other information that we host on WLEN.com. Altogether, we had 3.5 million page views last year, which is a very good average in a community this size. Our Facebook followers were 25,686. And actually, I just updated that number. Our Facebook views in the last 90 days are 3.2 million. I just got those numbers today. And we have, actually, that number is now 3,200 email subscribers to our daily email newsletter, which gives you the top 5 news stories of the day, plus obituaries, sports, and other information. We have a 40% open rate on those emails, which is well above the average. I'm sure Jen can tell you what those are for those who are not real marketing experts. We are also going to, we have to look at measurements. One of the caveats to this program is how are we going to measure what we're doing with this program at the end? So we're going to do that in 2 ways. We're going to do 3 online surveys in the first year. The first online survey is going to ask a series of questions about what do you know about opioid use in Lenawee County. And then we're going to repeat that 2 other times after the campaign has run for 6 months and then after the campaign has run for 12 months. So we can gauge if we're reaching people, how are we reaching people, and are they really, getting the message that we're trying to portray? The other way we're going to do that is we're going to look at the web traffic on stoptheaddiction.org. That website currently doesn't exist. The prototype, we own that domain name, but that website does not exist yet. So once we produce the website and once we start advertising the website, we'll be able to say, okay, the first month, this was our traffic on the website, and the 12th month, this is the traffic on the website. We are committed to, while this is an annual campaign for 1 year, we are committed to stoptheaddiction.org for 3 years. So we will maintain and populate that website because I know this grant, I believe, runs a 3-year cycle. So we will maintain that website and populate it for 3 years after we launch it. And then we decide what we want to do with it at that point. So one of the ways that we advertise the website is through our email contest newsletter, and that'll be the survey that we send out. We have, actually that figure is now well over 8,000 people subscribed to that. And again, the 40% open rate. And in the course of 2024, we had over 15,000 unique entries to contests on WLEN.com. So that's the way we're going to be able to measure how the program worked. So as I said, I was 15 minutes, and I will close with this. The campaign will include 3 full-time radio schedules, digital advertising, sports sponsorships, live events, 24 video podcasts, a 3-year maintained community resource website, and full tracking of results. And I think I'm within my 15 minutes, and I would welcome any questions.
Well, here, 15.
Okay.
Questions from committee members? Commissioner Collins.
Well, I had several questions after reading the application and going through, but you've answered them all almost. I have to tell you, I like this concept. I like the fact, one, that we're reaching different levels of the community and different dynamics in the community, even into the youth, with the schools. And I like the idea that you intend to collaborate with the other entities that may be funded and allowing them to get their program across to the county. Kind of a refreshing thought about collaboration. So overall, I really like the program. I have only one question.
Mm-hmm.
The messages you develop, where are you going to draw the content from for those? how are you gonna develop the content?
We would like to develop content with the agencies that are producing programming. Because we're not experts in opioid addiction. If there are areas that are lacking, we can go to state sites, through the Michigan Association of Broadcasters and our non-sustaining announcement program. We have access to resources on a state level. So if there's things that are not happening or being produced in Lenawee County that we think need to be addressed, we can go to, on a state level, and look for those resources.
Very good. Thank you.
Ms. Colley.
Yes, thank you. I echo Commissioner Collins' comments about the idea of being a resource and supporting all of the others. Seems a good one to me. I have a couple of questions related to the agencies and support services that you would feature, because your listening area or your coverage map is very large
Mhm.
and covers a lot of larger communities like Jackson and Ann Arbor and down into Toledo. Will you focus on Lenawee County support services only, or what do you anticipate that looking like?
I think that yes, absolutely. We would focus on Lenawee support services only. This is meant to be something for the county. And whether at the end of 3 years of this website, we give the website over to the county and say, here you go, or we figure out a way to keep it going. This is absolutely for Lenawee County. And as I said, I think the only reason we would go outside for resources is if there's not a place in Lenawee County that's producing the programming that would meet that need.
Thank you. Mr. Chairman, may I ask another question?
Sure.
Just on a separate note, you mentioned that you have done live remote broadcast in the past for Drug Take Back Day. Have you had community sponsors for that in the past?
Those have there was a grant previously, an LSAPC grant that helped to fund those. We've also worked with Lenawee Community Mental Health and ProMedica to fund those events. And of course, we do that on a nonprofit level, so we're not charging the full amount because it is, many of those places are nonprofit organizations, so we have a lower rate for that, but we find those to be very, very successful. And people call us, when we track our phone calls, they're calling, when's Drug Take Back Day? Or I heard that on, the community announcements that Drug Take Back Day is going to be such and such a day. And, and I'm like, don't go early because you can't leave your drugs till the sheriff's department gets there.
Thank you.
Ms. Zick.
Hi, just to caveat, you also covered the Day of Hope for 2 years. That was very successful, and that was, I know, graciously provided to us without a cost.
Mhm.
It was very, very successful with a lot of great stories and impact to the community. So that was something as well. The question, the ask of the funding, that is a one-time funding for a 3-year period?
That is a one-time funding, and all of the programs that you see in here are for 1 year. So they would exist for 12 months with the exception of the website. And the
Okay.
website we will keep and maintain for 3
3
years. Mhm.
Thank you.
Yep. And thank you. Day of Hope is great. I mean, those are the kinds of things I would love to populate the website with, like video stories of stories are impactful. Stories, the commercial you heard, stories are the way you connect with people because you don't want to just be talking to them. You want to be telling a story so they remember something.
Other questions? Mr. Cliff.
Julie, how would you, I guess what I'm trying to think through is, how would we measure success with your program? I mean, are we going to say, well, we have a database or we have I guess I'm just trying to think through, what if we didn't do this?
Mhm.
And just the normal word got out or, how would we measure success?
We have the 3 surveys that we'll be doing, so we will be able to track what the population's perception is, what their knowledge is, at the beginning of the program, halfway through the program, and at the end of the program. And we can in fact collect email addresses to do an email database if we want to do that as part of the survey. And then we'll look at the website and see what kind of traction we're getting on the website. You know, if 100 people visited in the first month and over the course of 12 months, we had 100,000 people visiting, we would know, because the only way they're going to find out about it, they're not going to find out about it organically. We have to tell them. And when you ask about what if we don't do a marketing campaign, everybody doesn't find out about our things organically. When I look at people trying to use Facebook for marketing only, you're reaching the people that you already reach. These are your people and they already know about you. We need to reach the people that don't know. And so by utilizing all of the resources, we're going to reach people that are listening to the radio, but they don't play online. We're going to reach people online that don't listen to the radio. We're going to reach people in various ways with podcasts and video. You know, the 6,000 people that come every week to our website and look at a video of us interviewing somebody who, you know, was an opioid survivor. You know, those are the kinds of, you know, and telling those stories. So I think we have to be very mindful of just saying, we're going to do all these programs, but we're not going to tell anybody we're doing them. Does that make sense?
Commissioner Collins.
Well, I would think an additional way to measure success, those entities that you're allowing to participate, the other grant applicants, you could get feedback from them. You heard it on the radio, we thought we should go there. So another measure of success is how those entities feedback with you.
Right. If people are going to them and saying, I hear you have this program, how do I get involved in this program? Or something like 174 click-throughs after 2 radio ads because people wanted to find out what we were talking about on the radio. I think those are ways we measure.
And I think because this is an ongoing program for like the next 5 years, I mean, you're going to know, the organizations are all going to know who else is getting funding. And there could be a quick little survey for each one of those organizations when somebody comes in that says, what drove you here?
Mhm.
You know, so working together, right?
And if we run different campaigns, say each month, we're running a different campaign about a different program or organization, they're going to see whether or not there's an uptick in what they're doing. If we focus on one specific program or organization per month, there's a lot of ways we can do it. And I think what we really want to do is gather with all the people who are receiving funding and have a meeting and say, what are you doing and how can these resources help you market what you're doing?
Good point. Other questions? Okay, well, thank you very much.
Thank you. Thanks for listening to me.
Our next presentation will be a collaborative care model into telehealth OUD treatment, and Work Health is here for that. So if you'd like to come up and introduce yourselves, and you have 20 minutes.
Thank you for the opportunity to present on our proposed project focused on enhanced mental health support, which is called collaborative care, where we're really aiming to reach and retain and improve the recovery outcomes of individuals in the county with co-occurring OUD and anxiety and depression. So we're using a collaborative presentation model as well. So I'm Cynthia Jimes, the Director of Grants at Work at Health, and I've been there about 3 years. My role is really focused on trying to identify grants and grant partners that enable us to innovate on our telehealth model, but also to really allow us to serve individuals who are uninsured or underinsured through grant funding. And my colleagues, Janessa and Amanda, are here today. Amanda, do you want to go next?
Yeah. Hi, I'm Amanda Olgeen. I'm the Senior Grants Manager at Work at Health. So I oversee a lot of our grant compliance and reporting, as well as assisting with some grant writing. I have deep connections to Lenawee County. I was born and raised in Adrian. I also worked on grant funding program in the county as well for 3 years. I worked on substance use prevention for our youth in Lenawee County schools. So I'm really happy to be back here to do this. So.
Good afternoon, everyone. My name is Janessa Perrin. I am the head of behavioral health at Work It Health. I have been with Work It Health for 5 years, and I provide direct clinical care to our members. And I am going to be beginning the presentation, so we can do the next slide. All right, so today we'll cover Work It Health's telehealth service model for opioid use disorder, our Lenawee County patient profiles, Work It treatment outcomes, and our project design, scope, and sustainability. So I'm going to start off by talking about our mission. So our mission is to improve the lives of people who struggle with addiction by providing patient-centered whole person care that is effective and affordable. And our vision is to live in a world in which people who struggle with addiction are empowered to receive the best possible care at the moment they need it most. So now I'm going to go into a little bit about our service model. And so Work It Health, we are a medicated assisted treatment facility that support members using a harm reduction philosophy. With the harm reduction philosophy, we facilitate one-on-one appointments with our providers, as well as group-based visits consisting of shared follow-up appointments that is between 4 to 10 members, as well as peer support groups and counselor-led support groups. Our groups also consist of themed-based groups, and so we just recently wrapped up a sober summer group, and we also do groups for the holiday season. We did groups about grieving during like the Mother's Day season and Father's Day season, so we really try to target our groups based on what our members may be dealing with in that moment. We also provide educational content via our courses, and so we have online courses for our members, and then a chat system that provides real-life support for members in real time. So one of the things I like to tell our members is that recovery is always in your back pocket with Work It Health. One of the ways that recovery is in their back pocket is because we are an app. And so if you go to your Google Play Store, there is an app for Work It Health. And so, but we are more than just an app and we are more than just an appointment. And so one of the things that we foster is community. And so we believe in community not only through our groups and members supporting each other, but through forum. And so we want members to have a way to connect in a safe way by coming to our community forum, which is in our online database, where they can talk about different things that they may be dealing with and struggling with. In addition to that, we provide groups 7 days a week to our members, and we also have evening groups as well. And then lastly, but not least, is we always have our integrated asynchronous tools, which are our courses. We believe that therapy is not always something that someone wants to engage with in their toughest moments. And so if they need courses, we can push them a course. If they're dealing with insomnia in the middle of the night, they can pull up their courses and get some techniques for sleep hygiene. All right. And so at Work It Health, we believe in improving efficiency. And so we have pre-appointment checklists and confirmation indicators to make sure that members attend all of their appointments. We also provide tech support. Like I said, we are in their back pocket and not everyone is tech savvy. And so we have a team that is dedicated to helping members with their tech support so that we can help streamline workflows and improve appointment readiness and engagement. And then last for me is our in-app care team. And so within our app, we have 3 different chat systems. We have the medical chat, which is where members can reach out if they need medication support, admin chat for pharmacy support, and then a counselor chat, which helps with psychosocial support. We also have innovative virtual drug testing for our members, which they can do self-administered or with a team member if they need additional support. And I've talked about courses before, they are great. And they are based in evidence-based techniques. And then, oh wait, this is the last for me, my apologies. And so individuals that we serve consist of anybody with a photo ID. And so in access to a computer. Those who struggle with opioid use disorder or dual diagnoses, as well as those who are not interested in the traditional treatment model. Those who live in a rural area and those who face barriers like childcare and transportation. And then lastly, those who are especially concerned with privacy. I'm going to go ahead and pass it over to Cynthia.
Great. So I wanted to share a little bit about who our Lenawee members are. And so since 2018, we've served about 143 residents in the county who have enrolled in our care. And when we break down some of the demographics of this community, the largest percentage are insured under Medicaid, but we have quite a substantial percent on commercial insurance, but about 10% are on self-pay. And then we also have a few people on our grant with the Community Mental Health Partnership of Southeast Michigan. Age ranges, the majority are between 30 and 54 years old. And then in terms of education, the majority report a high school or education or less. Moving on, employment. Okay, so the majority are full or part-time employed, but we do have quite a few members who self-report that they are disabled, unemployed, a few people in prison settings or other controlled settings. And then looking at housing, while the majority own or rent, we've got folks staying with families or relatives and also folks in transitional housing and shelters. So that's kind of just a summary of our current member base in Lenawee and our historical member base in Lenawee. So then I wanted to move into our impact and outcomes to really kind of touch on what you can expect in terms of what the outcomes would be for any new Lenawee residents that we enroll in the collaborative care model and our OUD treatment model. So first of all, we published a study looking at our rural members across all of our clinics, and we compared it to well-known studies out in the field. And we found that our retention rate at 3 months was at 62% compared to 50% looking at a study by Weintraub, which is a well-respected study. And then at 6 months, our retention rate was at 52% of people enrolled in care. And then compared to 22% looking at a study by Chua. But for this presentation, we really wanted to dive down and see what was happening with our Lenawee members. And wonderfully, they are being retained in care at a rate of 67% for both 3 and 6 months. So we were really excited to see that when we dove down. Okay, we have several assessments, self-reported assessments that we administer to our members at baseline when they come into care and then monthly. And one of them is our SURE assessment, and it's a validated assessment developed at King's College London. And we chose that assessment because it's designed by patients for patients. And when we look at the SURE scores, it's called the SURE, of our Lenawee residents, we see that coming into care, they're at 43. That's their score, their substance use recovery score. But by month 6, they've increased all the way up to 56. And a score of 45 or higher indicates in recovery. And the SURE looks at things beyond substance use. It looks at things like outlook on life and self-care and a few other kind of social need factors. Great. Oh, yes. So another study we did, we looked at Medicaid claims data, and we looked at it for all of Michigan. We don't have data specific to the county, but what we found when we compared individuals who were in our care to individuals that were not in our care was that we saw a reduced number of inpatient visits in the hospitals and reduced percentage of emergency room visits, and then reduced costs. So this is really especially relevant in rural communities where hospitals may be more burdened. And so I wanted to share that finding with you. And then lastly, I just wanted to go through, I'm going to kind of just jump through these. A few of our published studies, we have a research team that kind of works independently to look at our outcomes data and publishes in peer-reviewed journals. And so we did a study, as I mentioned, on rural folks across the clinics that we operate in. We did one on individuals with co-occurring hepatitis C who are in our care. We did one on individuals who receive their medications for opioid use disorder through a mail delivery service. And we wanted to look at, well, are they retained in care more than those who go to the pharmacy? Because we're really trying to help people with logistical barriers to accessing pharmacies. We looked at our members who are pregnant and tried to understand what the retention looked like for those folks. And then finally, we looked at satisfaction with care. And so through all of these studies, we really found that our telehealth platform is really feasible and viable model for retaining all of these populations and folks in care. Great. So now I'm going to turn it back to Janessa and Amanda. So Janessa is going to tell you a little bit more about our collaborative care model, and then Amanda is going to dive into the project design. Thanks.
So at intake, I'm ready for the next slide. Thank you. And so thinking about the proposal, at intake, 85% of our Lenawee patients present with symptoms of anxiety and depression, and over 50% present with moderate to severe symptoms. Compared to those with only opioid use disorder, individuals with opioid use disorder and co-occurring mental health disorders face more severe symptoms, higher opioid use relapse rates, and more hospitalizations. Expanding access to evidence-based integrated treatment through telehealth represents a crucial opportunity to reduce harm and support recovery for our Lenawee County population. So why collaborative care? So collaborative care is an evidence-based for people with opioid use disorder and co-occurring disorders. It relies on integrated care for sustained treatment that combines psychotherapy, pharmacotherapy, and behavioral interventions to address complex interactions for conditions like anxiety and depression. And so we've discussed clinical trials that have demonstrated that collaborative care for addiction treatment can reduce cravings, improve medication adherence, and increase recovery rates. And so some things about collaborative care is it's a treatment-based approach. And so it is a treatment-based approach where a behavioral health care manager works directly in contact with a consulting physician. We do this in a way to provide meaningful care that supports with behavioral health techniques like CBT, bridging together opioid use disorder and anxiety disorder to ensure that members at Work It Health are getting all-around care. And so it strengthens patients' engagement and it increases their retention here at Work It Health. We do that by doing studies with the PHQ-9 and GAD-7. It is a tool that we use in our measurement-based care. There's structured case reviews to help treat treatment inertia. This is scalable and effective because we use top-of-the-line clinicians, and so we use our licensed clinical social workers here at Work It Health to provide this clinical service as well as reimbursable CPT codes. Now I'm going to pass it to Amanda.
Okay, thank you, Janessa. So with this funding, we have really 3 key milestones. So the first is to ensure that we are providing the most effective treatment to members who come into our care who have substance use disorder as well as co-occurring mental health, like depression and anxiety. And so that will be achieved by training our behavioral health care staff. So again, those licensed clinical social workers and counselors in evidence-based interventions that supports this collaborative approach to care. And then second, we want to enroll 70 new Lenawee residents into opioid use disorder treatment. When people come into care, they are initially given those PHQ-9 and GAD-7s. We will look at those scores, and if it's indicated that they have depression or anxiety, then we will invite them to enroll in this collaborative care program. We also don't want treatment. We want to remove access barriers. That's what we are all about, is removing barriers to accessing care. So we don't want, say, lack of insurance to be a barrier for someone. So with these funds, we will be able to cover treatment costs for up to 10 individuals in Lenawee County who are uninsured or underinsured. And then last, we want to make sure that once our program is underway and we are serving individuals in Lenawee County, that we're really capturing the impact of our program. Not only do we want to capture that data, we want to make sure that we are sharing that data on a local level as well as on a broader scale as well. So we will collect our data, we will share that here with the committee and locally. We will also be able to present the program impact at academic and professional conferences as well as in a peer-reviewed journal as well. You're quick, thank you. And so I talked about the data a little bit. We will collect that through an internal database. So when Lenawee County residents enroll in treatment, we'll be able to collect that data as well as the number of patients who are members who are enrolled in grant-covered treatment as well. And then we will track those GAD-7 and PHQ-9 scores over time to see how mental health symptoms change throughout their care with us. And then we'll track attendance rates as well to see, are we retaining people in treatment? We know that those two data points are extremely important, as the longer people stay in treatment and the more their mental health symptoms improve, the greater their chances are at long-term sustained recovery. And then speaking of sustainability, we know that's at the forefront of people's minds, especially in communities where resources are finite. So if we are awarded the funding, we will use the dollars very strategically and efficiently so that we build out a self-sustaining program. So if we have members who come into our care who are uninsured, we will have a health care navigator that will work with them on connecting them to health insurance and helping them enroll. We will work with building relationships with payers as well. So we can, we already do take a lot of commercial plans, but we want to be able to expand that so we're able to cover treatment costs for more residents. And then building local partnerships and relationships as well so that we build a safety net for folks and we carve out referral pathways. Yeah, so this program isn't meant to be short-term. We want this to be a long-term solution to meet Lenawee residents where they are. So we really sincerely appreciate you inviting us to share more about our program. And I want to open it up to any questions you have.
So currently, how do people find out about your program? What's the avenues where mostly they're driven? You say we have 70 from Lenawee County.
Mhm.
How do those 70 find out about you, and then moving forward, others find out about you, et
Yeah.
cetera?
That's a great question. So we find that a lot of people in Michigan know about us. We were started in Michigan, in Ann Arbor. So we have really established ourselves in the state. We also use marketing. So a lot of people will find us through social media ads, through Google searches, and things like that. We also have worked with we have reached out to providers in the community as well. So Family Medical Center is one that I have worked on for other grants, and they have referred people to us as well. So it's really a mix of like advertisements and community partnerships.
Yeah.
And word of mouth, yeah.
For this grant, we're proposing a billboard in the county too, to support folks who maybe not online in learning about our services as well.
Commissioner Collins.
In the course of your presentation, I heard your age groups you referred to, You need a photo ID to be treated. What do you do about youth? I don't hear anything about youth.
We serve people who are 18 and above only.
Mrs. Colley,
Yes, one of the parts of this program, if you're awarded this grant, it looks like a goal is hiring 12 behavioral health clinicians to accommodate the increase in need. Is that correct?
We have 9 on staff and it's a mix of licensed counselors and behavioral health care specialists. And then we wanted to budget for 3 additional to be hired as we grew.
Thank you for clarifying. I see, and you want training cost for 12
Yes,
behavioral health
yes.
clinicians. How difficult is it to recruit behavioral health clinicians, whether they're social workers or counselors? You know, it's known that there's not only a shortage in Michigan, but nationally.
Well, thinking about recruitment when it comes to a LMSW, typically we have not had a lot of issue with that, being that we are in Michigan. And so we've contacted the University of Michigan as well as EMU for additional services with their job boards, with their clinical social work. We also hire LPCs as well. So we are not just looking for social workers, but we hire any clinical degree.
Thank you.
Ms. Palmoni.
Just out of curiosity, what do you do since you're based online? If somebody stops communicating with you, how do you communicate back with them to see if they're okay, if they're discontinuing treatment, if you need to help them further? What's your plan for that?
Yeah, so we use different communication methods. And so we reach out to them via their phones. Like I said, we're in an app, so we can enable push notifications to them the same way like your McDonald's app would do if you got a coupon, right? We can do the same thing to say, hey, you got an appointment coming up, or we miss you, please, schedule an appointment with your provider. We also send out emails as well as so we do push notifications, emails, and text messages to reach out to members. And so we have various methods of communication to try to keep members retained and engaged in a program.
Yeah, I will also, with our grant covered members, I will also, if I notice that someone hasn't been attending appointments, I will personally call them and reach out to them and check in on them and try and problem solve whatever barriers that are existing. If they need more treatment, then I will reach out to their provider and let them know what's going on.
Mr. Kelly.
This, just for clarification, are these all self-referral? People are calling for themselves to receive the services, or do courts require them to participate, or?
We do not have a lot of mandated members in our program. A lot of these members are self-referred.
Okay, and not to get too far into the weeds, but the drug screening process, how does that work in a nutshell?
Yeah, and so it's just that it is a screening, and so we use our drug screening as a tool, right, to make sure that members are taking the medications that they are prescribed, and not as a punitive method to see things that they are taking that they are not prescribed.
And your statement, not many that are mandated, but you do have some that are mandated?
Yes, yep. There are some people who we do send letters to the courts, to different judges, if they are in the program, but it is not something that we like outreach to. So with that being said, like people are there and they're mandated and we send them letters each and every month, but most of our member populations are self-referred and voluntarily there.
And I would add that we send every member a drug screening kit in the mail, and so we do that virtually as well.
Other questions? Ms. Zick.
So to clarify about recovery courts, is there any clinical reason why you don't reach out to do that collaboration with mandated treatment?
No clinical reason. I think it's just most times the courts because we're virtual, because we do virtual drug testing, it depends on the court and the agency if they would allow our services to be, utilized for that member.
My second question is regarding to the funding, it's broken down to a lot of with the extra staffing. and some training cost. So the majority of the other fees, is that for uninsured and underinsured? Because you would still be utilizing Medicaid or other insurances through the program, correct?
Yes, it's only for those that are uninsured and underinsured that the treatment portion of the other category would go to,
Sure.
as
Okay.
well as to their medication costs.
Right, so the bulk of it is for the therapist and training cost.
Correct.
Okay, thank you so much.
And the marketing and advertising costs.
Thank you.
Other questions? Hearing none, we thank you for presenting today. Thank you for being here.
This was a pleasure. Thank you.
Is there any public comment? Under public comment, I'm going to ask, we've had a number of inquiries as to how this process works and who's making the decision. As we all know, you're here to advise the Board of Commissioners, and the Board of Commissioners will make the final say on what is funded. So with that in mind, I'm going to ask each person to take just a very brief time to introduce themselves, the organization they're with or representing, and why they're here. And we'll start with Sheriff Bevere.
Sheriff Troy Bevere, I'm representing, obviously, Lenawee County Sheriff's Office. And the reason I'm here is because of the fact that we have a huge stake in the opioid crisis that we've been through. And we want to make sure that we're doing our part, not only at the sheriff's office where people can get, they can stop and get Narcan at a vending machine 24/7, but also we have a goal of making sure that people leave the jail better than when they came in. And so we want to make sure that we're doing everything and working with the community and our other stakeholders. And I think that this is important to make sure that somebody from the jail and somebody from public safety is involved in this process.
Thank you, Sheriff Bevere. Commissioner Collins.
Well, I am a county commissioner. However, my reason for being on this board is I have experience with a family member who has an opioid addiction for many, many years. God willing, he's been sober now for 13 months, but went through many, many years, many, many trials and tribulations. And I'm here both because of that, my background in law enforcement, and my position as commissioner.
Thank you, Commissioner Collins. Mr. Cliff.
I'm Gary Clift, and I was a part of the Big Brothers Big Sisters program many years ago. It's now the Boys and Girls Club. And I started out with my little brother when he was 8 years old, and his family had addiction problems and lots of things going on. And he's now 33 years old, and he has no job. He's on probation. He is, he has no vehicle, so he can't get a job. And I'm very concerned about how can a person that's in this kind of a position get their life turned around and come back and do something. I'm also involved in the Adrian Kiwanis Club, and we have a community impact committee. And we have a fund that we've put together over the years that we would like to be proactive and not reactive about what can we do to help this community. And in a lot of cases, I mean, we did the Riverside Terrace Apartments, which is a senior citizen facility. We put together that project. We put together the Kiwanis Trail, and there's just a whole list of proactive things we can do. Our mission is not just to give away money. Our mission is to take a look at what's the needs of the community, and can we be proactive and not reactive about making a positive impact.
Thank you, Mr. Quill.
Mhm.
Mr. Kelly.
Yes, Tim Kelly, I'm representing the Lenawee Community Mental Health Authority. I'm a board member there. I also have 30-plus years of experience in human services and have had personal experiences as well with addiction. So that's why I'm here representing.
Thank you. Ms. Hunt?
I'm Monica Hunt. I am the health officer, and I am here representing public health as it is a great concern and it's an epidemic. And so I'm here to help combat the stigma and help with harm reduction.
Thank you. Ms. Palmani?
My name's Sarah Palmani. I work for the medical examiner's office for Jackson, Lenawee, and Hillsdale counties. I've worked for Lenawee County Medical Examiner for 26 years. Obviously, our office is mandated by state law to investigate unexpected, sudden, violent deaths. And of course, some of those deaths include deaths related to drugs and alcohol. And so obviously, we're in the trenches doing those types of investigations. We, of course, report and keep statistics on drug-related deaths, and we also take part in review teams related to drug-related deaths.
Thank you. Ms. Colley?
I'm here representing the Lenawee Community Foundation, the president there, and we're a large granting organization for a lot of the services in Lenawee County that will help those that with mental and behavioral health concerns and addictions. Prior to that, I served in our state legislature as the chair of the Health Policy Committee, where this issue was very much in the forefront, particularly substance abuse in my early years in office, and also firsthand experience within our family with addiction.
Ms. Zick is not a voting member of this committee, but she's driving the committee. So Ms. Zick, yourself, please.
Hi, I'm Francine Zisk, Community Development Coordinator for Lenawee County. I've had the privilege in 25 years of a career to begin programs in county jails in Livingston County, testified in front of Congress, Washington, D.C., to allocate for monies to come back to Michigan. Leading this, my dedication is to give dignity of those with substance use disorder and those families encompassed by it, along with providing sustainability to the community in Lenawee with the best services possible.
Thank you. And the chairman of this committee is Commissioner Martis. He's out of the country right now, and he represents the Board of Commissioners as a commission representative, as Mr. Collins is representing an individual or an addiction party. So he is, his background is he's chairman of our Ways and Means Committee and Personnel Committee. So I'm here on a loaner basis. So, okay, thank you, everyone. Is there anything else to be brought before the committee? If not, a motion to adjourn would be in order.
So moved.
Support.
I have a motion by Commissioner Collins, supported by Ms. Colley. Is there any discussion? Hearing none, all those in favor signify by saying yes.
Yes.
Yes.